Do you have any comments on the vitamin D, ivermectin, zinc protocol?
If you want to put up, if I took 1,000 physicians across the United States and said, look, I want to do a study. This half of people we're going to give the vaccine to. This half of people, if they get infected, we're going to give them ivermectin, vitamin D, and zinc. There is not a single physician that would say this is okay. Maybe a single one, that guy, but not anybody that I know, not anybody that understands how this all works. Vitamin D levels, low vitamin D levels have been associated with more severe COVID disease, but when we've given vitamin D to people with COVID, it doesn't tend to make their course better. We've studied this. I'm fine with giving people vitamin D. I don't think anybody should ever be vitamin D deficient, but it's not going to cure your COVID. And if you're counting on that, you're sorely mistaken. Ivermectin's being studied. I hope it works. There's a lot of studies that suggest that maybe it does, a lot of very poorly done studies, and some well-done studies that say that it doesn't at all. And most of us think that this will be the same as hydroxychloroquine. Hydroxychloroquine had a lot of very poorly done observational studies that said, hey, maybe this works. And then when we studied it rigorously, it didn't work at all. In fact, it actually seemed to cause more harm. That's why we are cautious in doing this. This is not a benign medication. So look, I think the 15 patients, I mean, if I took 15 patients in my clinic who all came in with COVID-19, the stats are that none of those people would progress to, would be likely to progress to severe disease. So his study of 15 patients is laughable.